The World Health Organization strongly recommends exclusively breastfeeding infants for the first 6 months of life. Breast milk is the perfect food for a newborn. We wouldn't be here if our ancestors didn't have a way to feed their children. Breast milk is full of nutrients, antibodies, and it contains an ideal balance of fat and calories for a growing baby. But the benefits of breast milk don't end there.
Breastfeeding is very important, and there have been a lot of studies that show that children that breastfeed tend to have higher IQs, better immune systems, fewer colds, fewer illnesses, especially during the winter, less colic, less diabetes, less asthma. So there are a tremendous number of health benefits to breastfeeding. And also, there's also a tremendous bond that the mother and the child have when breastfeeding.
Then there are the benefits for mom. While breastfeeding, the uterus contracts, which can cause a bit of discomfort, but it helps the healing process after delivery. Breastfeeding also reduces the risk of breast and ovarian cancer later in life. Another benefit moms love? It helps drop that leftover pregnancy weight faster. Lactation consultants are available in the hospital to help women learn how to breastfeed immediately after delivery.
I'm a big fan of trying to get the mom on some sort of loose schedule as soon as possible. Now, you don't want to wait until the baby, at the beginning, you don't want to wait until the baby is asking for it. Get the baby on the breast every 2 hours, especially at the beginning, maybe 15, 20 minutes on each breast. 15, 20 minutes on one breast, 15, 20 minutes on the other breast, and then repeat about 2 hours later. And you want to do it about every 2 hours. And I say really stick to that 2-hour schedule until we see that the weight is coming on. Once the weight's coming on, then I recommend stretching out those feeds first at nighttime to see if the mom can sleep a little bit better. Because if the mom is well rested, then the mom is much happier and a much better mother, and the baby is happier also if the mom is happy.
This short, frequent stimulation of only 15 to 20 minutes is best. It encourages milk production without causing soreness or damaging the skin of the breast. At the beginning, breastfeeding can be challenging. It can take a few days to a week for the milk to come in, which is frustrating for new moms. In addition to the short, frequent stimulation, there are a couple of tricks to help spur milk production.
There are some anecdotal evidence of drinking beer, dark beer, sometimes brings the milk in. And I always tell the mom you could try maybe a glass or a can of dark beer a day. And it says for the mom, not for the dad. There's some anecdotal evidence of something called fenugreek, which is a vitamin that you could get that some moms say help increase their milk supply.
While breastfeeding can come naturally to some, that's not the case for everyone. If breastfeeding isn't for you for whatever reason, that's okay too.
If breastfeeding is not successful, which we do our best to avoid, and we try to give you a hand and work as a team to make it successful, there is formula feeding. And I always tell mothers, don't feel guilty if you wind up formula feeding. You do what's good for you. There are definitely advantages to breastfeeding, but when you make the decision, there shouldn't be any guilt involved. As I always say, that I was exclusively formula fed and I still turned out to be a doctor and I'm okay.
Sure, breast milk has the right calories and proteins and antibodies, but the one thing isn't guaranteed: vitamins. A woman's breast milk only contains the vitamins that are already in her body. This is easily remedied. Pregnant and nursing women should take supplements and eat a healthy diet rich in vitamins A, D, E, K, C, riboflavin, niacin, and pantothenic acid in order to produce vitamin-rich breast milk. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.